Hey guys, Dr. Shepard here. I wanted to talk to you guys today about a topic that has unfortunately become even more relevant over the past couple months, and that's the topic of health anxiety. So with the recent coronavirus pandemic, we have seen certainly an uptick in those people experiencing health anxiety. Although even, pandemic notwithstanding, many people will experience this sort of anxiety at some point in their lives. So I want to take you through what is health anxiety, when do these anxious fears and worries become a disorder, and how do we combat them. So I'll kind of take you through all that in this video, and as always, hit subscribe so that you can stay up to date with all the latest content and tips for your mental health. If you like this video, hit like and let me know in the comment section if there are other things that you would like me to talk about. So what is health anxiety? I think of health anxiety as encompassing a couple of different things. So first, I would say that health anxiety can include being anxious about normal bodily sensations. So, many of us at some point in our lives are going to have palpitations, and those can be something that can really freak some people out, even if it's a totally normal thing, to have a very brief skipped beat or something like that. So that's an example of anxiety about normal bodily sensations. You can also have anxiety about symptoms that you might be having, but thinking that they're caused by something much scarier than they actually are, or thinking that they're much worse than they actually are. So a good example of this would be someone who maybe has heartburn or indigestion and kind of takes that to the next level and thinks that they have some sort of stomach cancer or esophageal cancer as a result of that. And then the third way that I see health anxiety manifest itself is as fears that you have a certain illness. So even if you don't have any symptoms, you might still be afraid that you have a certain illness. So for example, you might be afraid that you have a brain tumor even though you don't have any sort of headaches or changes in your vision or things that we would normally look for as a medical community. But you still worry about it and you can't shake the fear that maybe I have something. So again, health anxiety in and of itself can certainly happen in normal people. And like I said, we're seeing a lot of that now in the case of the coronavirus pandemic because people are hyper vigilant about their bodily sensations. So people are so worried, understandably, about getting coronavirus, and it's such a scary thing that people are constantly monitoring their bodily sensations and saying, oh my goodness, am I short of breath? Is that cough the sign that something worse is going on? What if I have it and I don't know it? So all of these things can run through the mind of someone who doesn't necessarily have a mental illness. But I would say that I see them a lot more frequently in people that do have mental illness. So usually what that is generalized anxiety disorder, panic disorder. It's super common. Even people with depression or other types of anxiety can really have a lot of these health anxiety related thoughts and concerns. There are separate entities that are related to health anxiety that I think are personality traits that can kind of go to the extreme sometimes. So I talked a little bit about this already, but body vigilance. So a good example of anxiety sensitivity and something that's been replicated in a lot of different studies is the concept of your sensitivity to the amount of oxygen that's in your blood or the amount of carbon dioxide that's in your blood. So in many of these studies, researchers will do something like restrict the amount of oxygen someone can get or increase the amount of carbon dioxide that they're breathing, and watch how long that takes to trigger a panic attack. It sounds pretty awful, right? But this is what happens when we sort of hyperventilate ourselves. So they may do something like have the person hyperventilate, breathe through a straw, something like that. So what the researchers can then do is measure the amount of carbon dioxide or oxygen in each person's blood and monitor their response to those changes in oxygen and carbon dioxide. And people who are more anxiety sensitive are going to have more extreme reactions at smaller changes in their oxygen and carbon dioxide levels. So, for example, if I'm someone who's very sensitive to anxiety, you're going to see that at carbon dioxide levels that are relatively low compared to other people, I might have a panic attack. Whereas someone else who is less sensitive to anxiety can reach a higher level of carbon dioxide in their blood before they have a panic attack. So that's kind of the concept of anxiety sensitivity. And like I said, we all have varying levels of anxiety sensitivity. It's just a matter of how much and how that plays into the worries that might go through our mind. So like I said, these problems are pretty common in your average everyday person. So it's not until they reach a level of interfering in our day-to-day activities that we start to call them disorders. And like I said, the disorders that are most commonly characterized by this anxiety about someone's health are things like generalized anxiety disorder, panic disorder, that sort of thing. If the anxiety about your health is really the central symptom, so for example, in generalized anxiety disorder, you are going to have anxiety about your health, but you may also have anxiety about the finances, what the weather's going to be like, driving to your mom's house for a visit. So, for example, somebody with generalized anxiety disorder may have health anxiety, but they're also going to have anxiety about finances, about their children's health, about their job performance, lots of different things. So if health anxieties and worries about your health are really the central theme of your anxiety, and there really isn't much anxiety about other things, then that's going to fall under the category of somatoform disorders. These used to be called things like hypochondriasis, for example, but the terminology has changed quite a bit. So in the DSM-5, the Diagnostic Statistic Manual, which is a research tool that psychiatrists and psychologists use to classify different illnesses, these type of somatoform disorders are broken into two main categories. The first of which is somatic symptom disorders, and the second, which is illness anxiety disorders. So somatic symptom disorders mean that someone is overly preoccupied with a certain chronic symptom of theirs. So I would say a really common one that we see is abdominal pain. So for example, maybe if someone has had abdominal pain for several years and has had a full workup for their abdominal pain and nobody's ever been able to find an etiology for it, that may be an example of a somatic symptom disorder. Pain, physical pain can be another common one. Pelvic pain especially can be common, headaches. So all of these things, basically it's us saying this is a symptom that you've had for a very long time. We cannot figure out another etiology for it, so we think it's likely somatic symptom disorder. And we can talk later, if you guys are interested, about different etiologies of these disorders, but I'll sort of summarize it as saying we think stress and previous trauma plays a big role in these disorders. And they are much more common in people who have trouble expressing their emotions as emotions. So they kind of come out as physical symptoms more than emotional symptoms. So that's sort of somatic symptom disorder. Illness anxiety disorder is more focused around a certain illness. So whereas somatic symptom disorder is focused on a certain symptom and fear about what that symptom might mean, illness anxiety disorder is focused around a certain illness and the possibility of having that illness. So a person with an illness anxiety disorder might not actually have any symptoms, but they just can't shake the fear that they might have something seriously wrong with them. So an example of this would be someone who is not having any discomfort or problems in their abdomen, but they still say, I'm really scared that I have colon cancer. My dad had it, and I'm just sure that I have it. And despite all the testing and appropriate workup, they've not been shown to have colon cancer, but they still can't shake the thought that they might have it. And illness anxiety disorders can even happen in people who are having symptoms. The difference is just that they're focused more on the potential illness rather than the symptom itself. So if the person who is worried about colon cancer is also having chronic diarrhea, that could still be an illness anxiety disorder if the real focus is on the fear of colon cancer rather than the implications of the diarrhea and what that might mean. So that kind of summarizes the two main categories of somatoform disorders, which are disorders where the focus on health anxiety is really the primary issue. And again, those are somatic symptom disorders and illness anxiety disorders. So, but like I mentioned, health anxiety in particular is pretty common. So the vast majority of people that experience health anxiety are not going to have a diagnosis of a somatic symptom disorder or an illness anxiety disorder. Many of them will have an underlying generalized anxiety disorder or panic disorder, but it's not necessarily going to be the case that their health-related symptoms are the sole focus of their anxiety. So let's talk a little bit about health-related anxiety in someone who doesn't have an underlying anxiety disorder, or maybe has something like generalized anxiety or panic disorder, and how you can kind of manage those symptoms and cope with some of those fears. So here are a couple tips that you can use to manage this anxiety. So something that I find really helpful for all types of anxiety is to learn to practice mindfulness. Mindfulness is sort of the art or the practice of paying attention to your thoughts, to your feelings, to your physical sensations, to your surroundings and the present in an objective and sort of non-judgmental way. So mindfulness can be really helpful because it can give us the ability to distance ourselves from our thoughts and to approach them non-judgmentally. It's kind of interesting if you think about it. When a thought pops up in our head, we don't really challenge it. We just kind of take it as a fact. So that works fine for things that are factual. So for example, my shirt has stripes on it. Is what it is. I don't need to spend a bunch of brain power thinking about whether that's true or not. It just is. So that's a good example of why we all flipped out when the blue versus gold dress thing came out. It was very unsettling because that's a thought that we're used to having and it just is correct. But in this particular illusion, it was not. So likewise, we have a lot of other thoughts that aren't necessarily facts, but we definitely tend to take them as such. So for example, the thought that I have a little bit of chest tightness, I must have coronavirus. That's a thought that we can just take as a fact and spin off into a bunch of anxiety, when the reality is you may have that thought and you may become very emotional about that thought, very anxious about that thought, but all of that doesn't necessarily make it true. You either have coronavirus or you don't. And the strength of the emotion behind the thought and the strength of the fear behind the thought is not what determines whether or not it's a fact. So kind of using mindfulness as a way to separate thoughts and facts. Just because you think it doesn't mean it's true. So you can develop mindfulness in a couple of different ways. I think I've talked about this in a few videos before, but I'll try and make a video specifically on mindfulness. But there's already a bunch of great stuff online about it. And it's something that you can practice day to day in sort of an informal practice. So for example, something that I used in residency was every time I stopped at a red light, that was a cue for me to bring my mind back to the present. So you stop at your red light and say, okay, I was just thinking about X, Y, and Z that I have to do when I get home, but let's bring my mind back to the present and notice everything that's going on around me. And that helps you say, okay, I'm thinking. And that's helpful because it's a way that you're recognizing that your thoughts are thoughts. It's also really helpful because people that are anxious tend to get stuck in the future like that. And so if you can recenter on the present where there actually isn't anything wrong at the moment, that can be really helpful for your anxiety. The other way that you can practice mindfulness, and something that we can talk more about later, is with a daily mindfulness meditation practice. And it's not necessarily something that's religious at all. It just can be if you want it to be. But the idea is basically that you're doing a formal practice. So my red light strategy was sort of on the fly, but a daily mindfulness practice might look like sitting in a comfy chair, closing your eyes for a few minutes, and working on noticing your thoughts and noticing your breath and trying to keep your focus on your breath. And then noticing every time your thoughts drift away, you pull it back to your breath. So the purpose is not to get rid of thinking. It's to notice when you're thinking and notice when your mind goes off course and bring it back to what you're trying to focus on, which in this case is your breath. So it's really that process of bringing it back to your breath that really strengthens that muscle of mindfulness. And that can help so much with health-related anxiety. As I have told you and will tell you time and again, exercise is another super helpful tool in your toolbox to combat health anxiety and all sorts of mental health issues. So exercise is great for health-related anxiety for a couple of reasons. So first, it's good for just general stress reduction. It's going to make you less anxious, day in and day out. But it's also great because it's going to cause some of the physical symptoms that people tend to worry about with health anxiety issues. So for example, it's going to make your heart beat a lot faster if you're doing some cardio exercises. And if you're someone who worries a lot about palpitations, that can be really helpful because it kind of desensitizes you to the fear of the palpitations. Similarly, if you're someone who gets very anxious about shortness of breath, going for a jog and stimulating some of that shortness of breath in yourself can teach you that it's not as scary a sensation as you think it is. So another strategy that I find really helpful is using distraction. So if you're distracted and your mind is thinking about something else, you don't really have time to think about the anxiety and worry about the bodily sensations or possible illnesses like you would normally do. So this is an extra challenge right now because of many people being stuck at home while we try to limit the spread of the coronavirus. Anything that you enjoy doing and can occupy your mind for a while is a great idea. So things like binge watching TV or playing video games or reading, whatever it takes to kind of get your mind off of things. You want it to be something that engages your brain so that you don't have all this extra space to kind of think and worry. Anything that kind of takes up brain space and prevents you from worrying or ruminating about the things that are stressing you out. So another thing that you can do now that you know what this is learn a little bit more about that. So you know the terms now: health anxiety, body vigilance, anxiety sensitivity, the names of different disorders like the somatic symptom disorder and illness anxiety disorders. So those are things that you can look up and learn more about and kind of empower yourself with the knowledge of, this is not just you. There are a lot of other people that are experiencing these same issues, and you can learn a little bit more about what's worked for them. Likewise, you can learn more about the illnesses that you're concerned about. The trick here, and this doesn't work for everybody, so, if it's something that doesn't work for you, you want to back off of it. But the trick with learning more about the diseases you're concerned about is you have to learn a lot about them. So just a little bit of knowledge is going to make you scared, but a lot of knowledge and really understanding the illnesses that you're worried about, that's going to actually help. So I'll give you a good example. You see this in a lot of medical students. So when you first start out med school, you're constantly afraid that you have whatever illness you're studying. You think about it all the time. You're always worried about it, so much health anxiety. But then as you progress through medical school and you learn more and you sort of get some hands-on experience with those illnesses, that anxiety fades away. And you actually almost never hear of medical residents. So at the step after med school, you almost never hear about medical residents talking about their health anxiety. They certainly have it still sometimes. Doctors in particular tend to be more anxious people, but it's a lot better than it was in med school because they know enough to really be empowered and know that their symptoms aren't necessarily consistent with what they might be worried about. So with coronavirus, a good example would be you don't want to just learn what's happening on TV. You don't want to rely on the media information because that's just going to skim the surface and that's really going to freak you out. But talking with experts, if you can, reading a lot of reports about it, as long as they're sort of science and fact-based, knowledge-based, and you're getting them from reputable sources, that can actually be pretty helpful. So related to that, and something that you want to be kind of careful about is you don't want to keep Googling your symptoms. So you don't want to, yes, you can learn more about the illnesses that you're afraid of, and knowledge can be power with regard to learning about your own psychiatric illness, like health anxiety, or health anxiety related disorders. But you don't want to Google your symptoms because what's that going to bring up? If you guys have ever played that game, maybe this is a med school game. It sounds pretty lame now that I'm about to say it. But if you've ever done the thing where you put any symptom into WebMD, it comes back as some sort of cancer. It will tell you have cancer no matter what your symptom is. So that's why Googling symptoms isn't necessarily helpful, because it's going to give you everything from, the most benign possible cause to the worst case scenario. So I would stay away from Googling symptoms. Similarly, you don't want to do your own exams. So this is more commonly a problem with healthcare professionals who, for example, will check their own pulses or listen to their own hearts or, pound on their own bellies looking for lumps or something like that. It's certainly something that we see in people who aren't healthcare professionals, but doing your own exams is something that, human bodies are weird. We have idiosyncrasies. We have lumps and bumps everywhere. That's something that's just going to make you more anxious, because I guarantee if you go looking for weird things in your body, you're going to find them. We all have them, but they probably aren't significant. And so that's why I would say leave the physical exams to your doctor, and leave the understanding of differential diagnosis related to your symptoms to your doctor. So another thing that's been helpful for me personally, and this is, like everything, might be hit or miss, so take it or leave it, but I find that it's helpful to kind of focus on objective symptoms rather than subjective symptoms. So an example for the coronavirus would be, focusing on whether or not you have a fever as a marker for whether or not you may be sick versus shortness of breath. So I know for me personally, when I get anxious, I feel short of breath. That's just something that, happens. So that's not going to be a great marker for me to use to say, is there actually something wrong? Something objective like a fever, you can't get a fever no matter how anxious you are. So something objective like that can be a little bit more helpful. And obviously this doesn't work in all cases, and there are certainly exceptions to the constellation of symptoms that people can have with everything, including coronavirus. There are some people that don't have fever, but it can be one way for you to kind of let yourself know, hey, if there's something actually wrong with me, I will know about it. So you kind of use this as evidence for yourself that if something goes wrong in your body, there is a way that you will know it. So your subjective symptoms might not be entirely reliable, but the objective symptoms are. Related to that, I kind of alluded to this, but you want to sort of understand what your particular anxiety symptoms look like. So like I said, for me, chest tightness and shortness of breath, that's a big sign that I'm feeling anxious. And so now that I understand that, I'm able to say, okay, let's wait a second. I'm starting to get anxious about the chest tightness and the shortness of breath, but in the past, every time I felt that way, it's been actually related to my anxiety, because this is a common way that my anxiety manifests itself. You may have a very different constellation of symptoms. Perhaps you're someone that always has diarrhea when you're anxious, or always has abdominal pain when you're anxious, or always feels flushed, or feels like they're having palpitations. But no matter what it is, you kind of familiarize yourself with your own anxiety symptoms so that when they pop up in the future, you can know, okay, in the past, this is consistent with my anxiety rather than an actual illness that I might be suffering from. So other things you want to do, you want to limit the amount of reassurance you're seeking. So this could be coming from a variety of different places. So many people will seek reassurance from family members. They might seek it from their own doctor. And the problem with seeking reassurance is that you kind of reinforce the idea that it's a problem, and you're never really going to believe the reassurance. So there's really no sense in asking for it. And you don't believe the reassurance because you can never really prove a negative, right? So anybody that's been involved in research of any kind is going to tell you the same thing, that you really can't prove a negative. You can, maybe say with X amount of confidence that this finding is negative or that you don't have a certain disease, but you can never say 100%. So that's something that's going to kind of nag at you. Even when you're seeking reassurance, you're going to say, oh, well, they don't really know for sure. And it's just going to cause you to dwell on it even more. So also recognizing that you can't prove a negative, that you can never really fully reassure yourself that you don't have an illness, that can be incredibly helpful. You also don't want to avoid or push away the thoughts. So things like I mentioned before, distraction, that's okay because you're kind of engaging in something else and you're not actively fighting the thoughts. But if you've got health anxiety and you keep telling yourself, I don't want to think about it, I don't want to think about it, I don't have this, or you argue with yourself and say, no, that can't be right for this reason or that reason, again, you're kind of blowing it up in your mind, making it a bigger deal. And that tells your mind, hey, there might be something to this anxiety. She seems pretty worried about it. She's spending a lot of mental energy on it. It's kind of like, have you guys ever played with one of those Chinese finger traps where you like put your fingers in either side and you pull out? And the harder you pull out, the tighter it squeezes. That's like anxiety thoughts. So if you are anxious about something, the more you engage with that thought and the more you try to push it away or stuff it down or get rid of it, the more of a foothold it's going to have on you, the tighter that finger trap is going to squeeze. What you have to do instead is allow the thoughts to be there, kind of relax into them. Like we talked about earlier, thoughts aren't necessarily facts. So you allow yourself to have any thought that you want. You kind of relax into that finger trap, and that's when the finger trap loosens up and lets your fingers out. Learning relaxation exercises can also be really helpful because then you can employ them whenever you're feeling your sort of hallmark physical symptoms of health anxiety. So an example for me, if we're talking about how my chest tends to get tight when I'm anxious, maybe I sit down and do a mindfulness exercise or a body scan or some sort of meditation, something like that kind of allows me to relax a little bit. And once I'm relaxed, I'll notice, hey, okay, that symptom went away that I was really worried about. So it must have been related to the anxiety that I was feeling. I think what I'll do in the future is come up with a video that kind of talks a little bit more about each of these relaxation exercises, but there's lots of resources available on YouTube and lots of other places where you can learn some of these relaxation techniques. The techniques themselves tend to work better for different people, depending on the person. So don't give up if the first one doesn't necessarily work all that well. So say you've gone through these relaxation exercises, you're in a pretty good place, or you're just having a good day and you're not too worried. One thing that we do in therapy is we'll kind of try to take people through the worst case scenario. And again, this is something you want to be pretty careful about. So I would recommend doing it with your therapist, at least for the first couple times, until you're really confident that it's not going to sort of send you into a tailspin. Because what you want to do is expose your mind to the things you're worried about, but not so much that you're overwhelmed by it. So using these relaxation exercises while you're sort of taking yourself through, okay, so let's say worst case scenario, I do have coronavirus. What is the most likely thing to happen after that? What would that look like? And then what would happen after that? And then what would happen after that? And kind of taking yourself through almost a doomsday scenario. And for some people that might seem a little bit scary, but for other people, just kind of thinking through it sort of logically can help you kind of put things in perspective and help your brain not react as strongly to those worst case scenarios when those ideas pop up in your head later. Another way to kind of use exposure therapy on the fly is, like I said, to not try and push the thoughts away, to allow them to be there when they want to be there, to recognize that thoughts are just thoughts and not facts, and to say, okay, I'm gonna think, if I'm worried about this, I'm gonna let myself think about it. Some people find it really helpful to have a certain period of time during the day designated to their worries. So, for example, I know we're taking my example a lot, but say you have chest tightness earlier in the day, you might tell yourself, okay, that's fine. I'm feeling this chest tightness now, but right now I'm making my YouTube video. So later on today from 4 o'clock to 4:10 p.m., I am going to sit and worry about my chest tightness. And just kind of having your brain know that that's something that you have a designated time for, as silly as it sounds, can actually be really helpful. Another thing that can be helpful for some people, again, as long as you're not giving too much weight to the anxious thoughts, is thinking about probabilities. So, coronavirus as an example, the worst case scenario for that is death, which we know is absolutely possible. We have seen that people have died from this illness. But taking it from another angle and saying, okay, let's say I did get coronavirus, which is of course entirely possible. What is the probability that that worst case scenario would actually happen? And depending on, your demographics, what age you are, what underlying medical conditions you have, that's going to look different for different people. But it's something that can be reassuring to some people to say, okay, well, there is a pretty high chance that I would actually be okay. And, we have tens of thousands of cases, but not everybody gets a serious illness and not everybody dies from it. And that's actually much less likely than the alternative, which is a full recovery. So, helping yourself understand that yes, there are these potential worst case scenarios that could happen, but those are actually fairly rare compared to the alternative possibilities. Again, your mind is going to be pretty biased on this because most of us get this information through the media, and the media is going to use sort of dramatic statistics and uses a lot of like scary language to kind of grab the viewer's attention. So you have to be careful. That's another thing where, a little bit of knowledge is bad, but a lot of knowledge can be really helpful. But overall, sometimes people find it really helpful to think in terms of probabilities. And then finally, as I'll tell you a million times in this video series, therapy and medication can be extremely helpful. So if you're not working with a therapist or a psychiatrist, I know we're under these new rules of social distancing, which can be a little bit strange for, figuring out a way to get health care and mental health care especially. But a lot of people that work in mental health care are actually using telemedicine right now, myself included. So I work primarily with older patients, and we want to limit their exposure to the illness. So we use telemedicine as a way to do therapy and diagnose people and treat people. So you may be able to find a provider who's able to do that. So working with your mental health care provider is a great way to get these sort of health anxiety thoughts under control. In some people, especially people that have an underlying anxiety disorder, they're going to need medications to treat this. So that's nothing to be ashamed about if you need it. Many people, these strategies just don't work because it requires that your brain chemistry be in the right place to be able to take advantage of it. So if you're trying all of these strategies and it's really not doing anything for you, you may be one of those people that just needs a little bit of a boost from these medications. Something that I like to say is that if you can't make your own neurotransmitters, store-bought is fine. Nothing wrong with taking medications if you need them, and many of them can actually be really, really effective. So most commonly, I would say for these sorts of anxiety disorders, we like to use SSRIs or selective serotonin reuptake inhibitors. There are lots of other medications to choose from, but SSRIs are sort of the most commonly used. So again, something to talk with your doctor about if you feel like you're trying these strategies, they're not really working, or you can't really do them. Medications can certainly be helpful. So as always, this is not intended to be medical advice. It does not supersede the advice of your physician or your therapist. Please consult them first before doing any of these changes. And if you like this video, please like it so I know that this is the kind of content you want. If you didn't, drop me a comment and let me know what you'd prefer to see. Obviously, I'm pretty new at this, so I would love to hear your thoughts, ways that I can be helpful to you guys, and any questions that you might have that I could answer going forward. If you are interested in getting more mental health tips and more insights on motherhood and doctoring from my perspective, please hit subscribe and turn on notifications so that you won't miss a video. Like I said, let me know in the comments if there's stuff you want me to talk about, but thank you for joining me and I hope this was helpful. Stay well.